Welcome to Module 5, A Problem Worth Solving, part of the NHS Insights Bite-Size Innovation Series. NHS Insights is a peer-led innovation program designed to harness the collective insight, energy, and expertise of member sites across the country. By empowering entrepreneurs and enabling organizations to adopt innovations, the NHS Insights program helps deliver the highest standards of care where it matters most. This bite-size innovation training module is one of a series of modules, which have been produced to develop a culture of innovation, reinforce innovation-related knowledge and empower all staff to be innovation-aware and ready. Every great innovation starts with a question: is this a solution looking for a problem? Or are we addressing a problem truly worth solving? In this session, you'll learn why identifying and validating current challenges and unmet needs are the most important first steps in any innovation journey. You'll also discover how to define problems clearly, how to check whether they're shared across the NHS, and how well-defined problem statements can guide you toward meaningful, impactful solutions. When you understand the real problem, everything else becomes easier. How do we establish and validate these unmet needs? Before designing or seeking out an innovation, we must first understand the challenge we are trying to address. Begin by asking, which tasks are inefficient, frustrating, or both? Which processes take far too long, or produce inconsistent outcomes or results? And importantly, is this challenge unique to my team, or is it widespread across the NHS? Validation is key. It is vital to see whether colleagues elsewhere experience similar issues, to see how widespread the problem is. How can we check whether others are in a similar position, or have identified innovations or solutions which address the challenge we are facing? Methods include having informal peer-to-peer discussions, exploring resources such as NHS Futures, where NHS staff share insights on improvements and challenges, and attending workshops, events and webinars with innovators across the system. Understanding the scale of the problem tells you whether the need is local or national. Why problem definition matters. Once you identify an unmet need, the next step is to define it clearly. Because, if you define the wrong problem, you will almost certainly design, or procure, the wrong solution. A well-defined problem is the foundation of impactful innovation. As the saying goes, a problem well stated is a problem half solved. And remember, patients, clinicians, managers and payers often have different needs and expectations. A strong problem definition considers all perspectives, not just one. What makes a good problem statement? Let's compare two simple problem statements. Statement A: clinics are inefficient. This is poorly defined, with no sense of scale. Statement B: manual data entry makes patient interactions in clinics 30% longer. This is clear, precise, actionable. A good problem statement should be clear, no jargon, no vagueness, evidence-based, supported by data and lived experience, focused, narrow enough to tackle the issue, but broad enough to matter, actionable, so that it points toward potential solutions, and finally, impact-driven, demonstrating why solving it matters. When a problem is defined well, solutions become far easier to identify and justify. Here is another example. Mental health services for young people. Consider these two statements. Statement A: there aren't enough mental health services for young people. Statement B: demand for children and young people's mental health services has risen by 39% in the last 3 years. Waiting lists now average 9 months, with longer delays in deprived areas. Young people describe feeling abandoned during waits, and highlight stigma, digital access challenges, and school pressures. Current solutions focus on crisis care or generic well-being apps, with limited integration into NHS services. We need an approach which has been co-designed with young people, which can offer timely, stigma-free, accessible support that fills this gap. Which statement creates a clearer path to solutions? Which one builds stronger evidence for further investigation? Which one centers on lived experience and health inequalities? Statement B tells us what the problem is, who it is a problem for, and what impact solving the problem will have. So, how do we connect problem statements to solutions? Once your problem is clearly articulated, you can begin exploring solutions by asking, why is this solution different? Why is it better for the patient? Why is it better for clinicians, or carers, or the wider system? Does it address the root cause, not just the symptoms? The strongest innovations are those shaped with, and for, the people they serve. Here are some key takeaways. A clear, evidence-backed problem statement is the foundation of innovation. Patient and public involvement increases relevance, trust, and impact. Designing for health inequalities requires conscious design choices, not assumptions. When defining your next problem, ask yourself, who have you co-designed with, and who's missing from the conversation? Thank you for watching this video. To get involved, or learn more about the NHS Insights program, visit the Insights program website and connect with your local innovation team and leads in your own organization, trust, or ICB. You can also engage with your local health innovation network to explore further opportunities in innovation and adoption.